So today we're just going to be doing a practical cranial nerve examination guide. So as we all know, as we should know, there's 12 nerves in the cranial nerve examination, covering both sensory and motor nerves, and sometimes both. And these have a lot of functions. For a full exam, they assess for every deficit, and it's very long and quite uncomfortable for patients with the gag reflex in nerve 10 and the corneal reflex in nerve 5. But what I'm going to be teaching you here is just a shortened and practical guide for the examination where not all the functions are assessed, but it's faster than the long exam, but it's a quick assessment and we're assessing for the most important and the most common deficits. As we all know, the cranial nerves, 12 nerves as we said, olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal. Now all of these correspond to a function of the face, and as we go through them, as we assess the nerves, we're just eliciting these functions and eliciting different responses. Now first, we always want to start with observations and just assessing the patient. So from those we can get quite a few of them down. We can look for visual neglect by just checking if they're neglecting one side of their vision, which can check for any optic nerve damage. Then we can also just look for closeness in the eye, which assesses one of the functions of the oculomotor with the eyelid and some of the eye muscles. Then we can also just look for asymmetry of the face, looking for a facial nerve palsy. And then when we watch them walk or we watch them just get to the bed or move around the bed, then we can assess for balance as well. And then we start talking to the patient, right? We ask questions for the examination. First, there are some different ways to assess for the olfactory nerve function, but most of the time we just ask, have you noticed any strange scents, or are you smelling things differently? And that assesses smell. And then we can also ask about their hearing. Has their hearing been different at all? Now, with the hearing, there's another function test that come in with the Rene and Weber's test, where we use a tuning fork to assess for hearing loss between the two. But since this is a practical guide and that will take a long time to do, we can say if we do have a tuning fork, then you can do it. But if you don't, then it's not needed to assess the hearing because we can just ask if there's any hearing loss. And then we can also ask them if they're having any problems with their sight. That does half the visual acuity. So going through, now we go on to actions. For the first set of actions, we probably want a piece of paper or just any words on the wall, anything on your phone, anything. If you have a notepad, just ask them to read off the notepad, read off the wall, and then we've tested for visual acuity and say that do you need any glasses, because then that can see if the visual acuity is due to them not having their glasses or not. Then next, we need a torch. Now, not everyone carries pen torches around, but if you have a pen torch, great, use it. But everyone pretty much carries their phone around, and we have a torch on our phone pretty much always. So when we're assessing for the pupils, we shine a light into each of their eyes, and we're testing what the size is. Do they have a pupillary reflex? When you shine the light in their eyes, are their pupils constricting? And if doing the swinging light test, which I'll show you in a second, we can do the pupillary reflex, and we've also assessed the pupils. Now, next, we all have a finger, I hope, and now we can test for visual fields. So with the visual fields, what we're doing is we're assessing whether, with them looking in our eyes, can they see our finger when we put it on the peripheries of their visual fields, and if they are intact. Next, we got on to eye movements, which cover ocular, trochlear, oculomotor, trochlear, and abducens nerves. Now, the eye movements, we allow them to follow our finger or a pen if we have it in the shape of a H. And we're assessing for all 6 eye muscles, especially the trochlear for the superior oblique and the abducens for the lateral rectus. So that's done. Now, moving on, we've got the facial nerve, which covers the sensory portion of the face. And we basically do a top-down approach for that. We touch just above the eyebrows, near the cheeks, and just on the mandible here. And we assess whether they can feel it and if it's the same on both sides. Next, we check for mastication and the jaw jerk, which we assess for the mastication muscles after they clench their jaws, and if there's any muscle wastage, and then the jaw jerk, where we tap their jaw to see if they have the reflex. Going on, sorry, one thing I forgot to say was, when we're asking questions, we ask them, did they have any certain senses of taste, or have they noticed any loss of taste? That is also done. And then, after that, going still on the facial nerve, we're going on the facial movements. So, we do a top-down approach for that. We again start at the eyebrows, where we ask them to move their eyebrows up, then scrunch their eyelids, puff out their cheeks, give us a big smile, and then purse their lips. That assesses all the functions of the facial nerve. Next, we've done balance, hearing, and we can do the Renee-Webber's test. Next, we can do the head thrust for the vestibulocochlear, where we assess their balance and see if they have a head thrust reflex where we move their head quickly and see if their eyes still follow us even though we move their head quickly, which I'll show you in our demonstration. And then for the glossopharyngeal and the vagus nerve, we ask them to see if they can swallow, maybe if they have some water or just swallow their saliva. And then we test their cough as well. We ask them to give us a big cough, and that assesses the vagus nerve. Next, the accessory nerve, you're testing your sternocleidomastoids and your trapezius muscles, and we're checking for head and shoulder movements. We're asking against force to shrug their shoulders and then also do head turns as well. And next, going on to the hypoglossal, we get them to stick their tongue out and move their tongue side to side. And that is the practical cranial nerve examination, which I'll show you in a bit.
Okay, so we're going to practice the cranial nerve examination today. So when you're doing the cranial nerve examination, you want to be able to see their face and be face onto them. Sometimes you can't do that when they're laying on the bed, but if you can get them to sit up on the bed facing you, at least if they're laying on the bed, put it to at least to like a 45, 60 degree angle so they're sitting up and they can move their head normally and you can go in and look at their head in a straight manner. Alright, now, first off, just looking at your face, we want to look at just any signs of facial asymmetry, any signs of ptosis, and then any signs of just like, if you can just walk around, if you can get them to walk around. I won't get you to walk around for now, just in the interest of time. But just a few questions for you. Have you noticed any strange smells? Have you noticed yourself losing your sense of smell, taste, hearing, and your balance is okay?
Yeah.
All right. And then going through that, looking for any signs of just facial asymmetry, any signs of visual neglect. He's not visually neglecting any signs of his vision. Now, going on, we're going to look at his pupils. So the first thing we want to do is look at the pupils, see if they're equal. And his look equal about 5 millimeters. So you always want to comment on how big it is, because then we can compare that to when we do the pupillary reflex and when we shine the light in their eyes. All right, and now after looking at the pupils, and then we'll get him to do like a visual acuity. Is there anything you can read on there? Is that clear for you?
Yeah.
And just look for any signs or anything, and then see if they can read it from far away. And then maybe on your phone, if you have the time, you can get them to read the time.
4:46.
Lovely. And so that just test for visual acuity really quickly instead of doing a Snellen's test. Afterwards, if you are concerned about their visions, I would recommend doing a full Snellen's test just to be complete. But this is just for a practical and quick way to do it. And now, looking at the eyes, we can use a pen torch, or you can use your phone, and we just test the pupillary reflex. We want to go around to one eye, and then to the other, and then covering the middle of the face so that the light doesn't shine between the two eyes. We want to shine the light in one eye and see if it is equally reactive in the other one, and it is. So that's good. So you're just looking for the pupil reaction there, as I explained. Next, we'll do the visual fields. So now looking straight on at me and not moving your eyes, I want you to see if you can see this finger in the middle. So you want to keep the finger in the middle between of the two of you and the patient, and then you want to go down. You can see the finger, and you can go up, and then switching fingers, go there, and then up. You don't want to be doing this, just because that's a bit awkward, and you have the arm in front of the face as well. So you have two hands, hopefully, so just use them. And now, going through that, we go in and we'll be looking at eye movements. So then, using your finger, you're going to have them follow the finger with your eye. I like to do the horizontal one, just to be looking at any abducens nerves for the abducens nerve palsies, because they can have a horizontal diplopia, and then doing this one, and then up and down, and the vertical diplopia comes with the trochlear nerve, and then we're going, and then we're doing basically a H, so I did a cross first, and then I also just like to go diagonal just for completeness. Okay, and next, we've finished the eye movements, and now we're going to be looking at the trigem. So this is mainly a sensory nerve. So I'm now just tell the patient, okay, I'm just going to be touching your face, and you touch their face, first above the eyebrows, and then ask them, can you feel this? Does this feel the same? Does it feel the same? Okay, and now you go just on the cheeks here, and you're looking at the second branch of the trigem. Does that feel the same?
Yep.
And now you're just going right underneath there on the jawline. Does that feel the same? Okay. And now you've done the sensory, and now you go for the motor. So you look for any signs of masticator muscle. So you just look to see if there's any signs of muscle wastage. His masticator muscles are normal, and then we look at the jaw jerk. So if I can, it's okay. So and now we look at the jaw jerk. So I'll get you to just open your mouth slightly just relax. Don't try and open your mouth. And now you just have your finger on their jaw, and then just tap, and you should just feel their mouth just close slightly. And if you can't feel that, then that shows that the jaw is not there, and also it is bad if the mouth just suddenly closes, which shows that there is a palsy in the trigeminal nerve. Next, we've been going on to the facial movements. So, can I get you to lift your eyebrows up for me and scrunch your eyes? It's good to, if they're willing, I'll just ask him, while you scrunch your eyes, is it okay if I try and open them? Yep, so if I scrunch, open, lovely, and then we do the smile, purse your lips, and then blow out your cheeks. Yeah, lovely. And then we go through and we've done the hearing and the balance, and now if you can just do a swallow for me. Lovely, and then a cough. Yep, and then we'll do next the accessory nerve. So we're going on to the sternocleidomastoid muscles and trapezius. So you want to have your arms on the shoulders and get you to shrug your shoulders for me against. And then also what I just like to say is I'm going to put my hand on your face and you're going to turn your head against it. So then go, lovely, and then yeah, lovely. And then we're also just doing the hypoglossal nerve, which is the tongue. So if I get you to stick your tongue out and then stick it side to side, lovely. Thank you so much. And that's your cranial nerve examination done. Now I'll get the student to practice on me.
Right, so hi, my name's Jacob. I'm one of the doctors here, just going to do a cranial nerve exam on you today. So to start with, have you noticed any changes in your smell, hearing, or balance? No, okay, that's good here. And now I'm just going to test your visual acuity. So are you able to read that sign on the wall there?
Stay wise.
Okay, perfect. And are you able to read the time on my phone? Yes, 5 o'clock. Okay, good. So visual acuity, there's no concerns there. We're going to now look at your pupillary reflex. Yep. So I'm going to use my phone to shine light in your eyes. And to begin with, pupils are equal about 5 millimeters in diameter. And now just look straight ahead of me. And pupils are reactive to light, constricting to about 2 millimeters. I'm also going to check now to see if both reflexes are present. So just put my hand here. And both pupils are constricting away. Right, let me look at visual fields now. So I'm just hold my finger out and can you tell me if you can see my finger? So you can see it here? Yes. Yeah? Yeah? Yeah. Yes. Right. Can I get you to look at the sign on the wall? And now can I get you to look at my finger? Perfect. And now just follow my finger. So I'm going to go across here. Right, perfect. Now, so eye muscles innervate correctly, there's no issues there. I'm now going to check facial nerve. So, did you know first? First. Right. Now, get you close your eyes and make sure that you can, I'm going to touch your face and can you tell me if it's equal both sides? Is that the same? Yes. Is that the same? Yes. Is that the same? Yes. Okay, good. You open your eyes now. And, okay, now I'm going to check for muscles. I'm going to check facial muscles, see if there's any muscle wasting. If there's not, can I get you to puff up your cheeks and facial lips? Right, can I get you to just relax your jaw open your mouth slightly? I'm just going to tap you on the chin. So reflex is normal. Now, going to get you to raise your eyebrows. Can you do that for me now? Yeah, perfect. And can you close your eyes and don't let me open them? Okay, and I'm going to test your hearing now. So are you able to hear this? Yes. And is it the same on both sides? Yes. Okay. So here, can you get you to swallow for me? Perfect. Now I'm just going to test your trapezius and sternocleidomastoid muscles. So can I get you to sit up? And I want you to shrug your shoulders. Perfect. And now I want you to turn your head into my palm. Right. Good. And good. And finally, can you stick your tongue out for me? And move side to side. Right, thank you. So all in all, this is a normal cranial nerve exam with no sort of concerns.
So we completed the cranial nerve examination, and we had me talk about it, and then I demonstrated it, and then I had you demonstrate it on me. Is there anything you'd like to say about how you did the cranial nerve examinations?
I think it was all right. I sort of lost where I was up to in the exam a couple of times. Yeah. But was able to get back on track, so I thought that was okay. Yeah, that was good. I saw that you were working through it in a systematic way as I taught you, and there were a few things that I saw that were really good about how you explained what you were doing and explained like how to do the things you were asking me to do. So that was really good in terms of patient, because although that we're doing it between us as medical students and doctors, we know the exams, but when a patient comes in and has to do it, they have no clue about what they're doing as well. So what makes sense for us might not make sense for them. So it was good that the way you explained it as well. Is there anything you felt like you had to work on? For some of the exams, I wasn't quite sure like how to do them. So, for example, the facial nerve, I had sort of stumbled over testing sensation and motor movements. Yeah, and as you go through it and do more cranial nerve examinations, you'll find that you'll forget some things here and there, because there's 12 nerves that you have to do, and sometimes it's not as easy as it looks, but that's what practice does. And if you get into a habit of just doing all 12 nerves as you go through, even though that this is like just a practical cranial nerve examination, it does go through all 12 nerves. What kind of strengths did you find in the I think I was able to do the whole exam pretty quickly, which is what I really wanted to get out of this.
Exactly, and like that's what I've been trying to teach as well, because a normal cranial exam, which is really good and very comprehensive, does take around 10 to 12 minutes for someone who even hears practice, especially with all the pinprick testing that we haven't done here, and the gag reflex and the corneal reflex, which would have been uncomfortable for the patient. So it's really good that you were able to do this really quickly, even though we had just taught it to you as well. And you had a bit of background, but going through and doing all the things that I've asked you to do as well is really good. The one thing that I will say is that it does boil down to more and more practice, but some strategies you can do is just know all 12 cranial nerves, and however finds you that it may work for you, such as a mnemonic, or just like memorizing it straight up, and just going through that in your head and just ticking it off mentally as you go through. And as you get more and more familiar, even if you don't get all the bits in the cranial nerves, you'll get all 12 down, and then you can work on doing everything in the cranial nerves. One thing I did notice was that you didn't ask me to smile for the facial nerve one, and when you asked me to puff out my cheeks and purse my lips, you kind of did it during the trigeminal nerve part of the examination, even though it was the facial nerve next, so I can see where you got a little bit confused. But other than that, it was a really good examination, and you went through it really well and in fast as well.
Thank you.
Okay, thank you.